Good afternoon, everyone. My name is Nirav Shah. I'm the Director of Maine Center for Disease Control and Prevention, and I am joined this afternoon by Commissioner Jeanne Lambrew of Maine's Department of Health and Human Services. Commissioner Lambrew and I are delighted to be with everyone today to provide an update on the COVID-19 situation across the state of Maine for today, Thursday, October 22nd, 2020. I'll begin by providing an update on the epidemiology and where things stand with the disease, and then turn things over to Commissioner Lambrew. Right now, across the state of Maine, there are a total of 6,064 cases of COVID-19 statewide, representing an increase of 37 cases since yesterday. Of those, 5,411 are confirmed, and 653 of those cases are probable. One epidemiological note is that we have logged an additional increase of 6 cases of COVID-19 just in Washington County. We are currently investigating those cases to determine if there are any connections among them. We will have more updates on that as our investigation unfolds. Overall, 473 individuals have been hospitalized cumulatively. Over the past 30 days, 26 have been hospitalized, and right now in Maine, 7 individuals are currently hospitalized. Thankfully, none of them is on a ventilator and none of them is in the ICU. To put that number in a bit of perspective, that makes our current hospitalization rate in Maine approximately 0.5 hospitalizations for every 100,000 Maine people. That number stands in contrast to the national hospitalization rate, which is at 11 hospitalizations for every 100,000 people right now. Sadly, 146 individuals have passed away and 5,268 have recovered, an increase of 33 recoveries since yesterday and the same number of individuals who have passed away. Among our cases are 1,116 healthcare workers. In terms of our testing stats, our 7-day positivity rate in Maine right now for PCR tests is 0.53%. And our testing volume, the number of tests that are being conducted for PCR tests, is 439 tests for every 100,000 people in Maine right now. I'd like to provide some updates on the outbreak that Maine CDC is investigating in the Waldo County area. The total number of cases associated with that outbreak is now up to 49, and we expect that number to increase over the next days. Currently, there are 3 individuals associated with this outbreak who are hospitalized. I also mentioned on Tuesday that one of the schools that is implicated in this outbreak is the Troy Howard Middle School in Belfast. There was an individual there who was a probable case associated with that school. That individual subsequently received COVID-19 testing and has tested negative. And thus that school is not considered to be part of the outbreak right now. The other 3 schools that I mentioned are still part of the outbreak investigation. But I'd like to stress again, those schools are not experiencing outbreaks of themselves. We are not aware of any transmission that has occurred in any of those schools that I mentioned on Tuesday. Those are, for example, Captain Albert Stevens School in Belfast, among others. Again, we are not aware of transmission that has occurred in those schools. We've also been working very closely with healthcare providers across the area to offer expanded testing opportunities across the county. Right now, Penn Bay Medical Center in Rockport, Waldo County General Hospital in Belfast, and the Seaport Community Health Center, also in Belfast, are all offering expanded testing for COVID-19. If a Maine CDC contact tracer has reached out to you because you are a close contact, please answer their questions. Those Maine CDC contact tracers can also advise you about getting tested. If you have symptoms of COVID-19, whether that is a cough, fever, shortness of breath, a loss of sense of taste or smell, among other symptoms, please consider getting tested at one of the facilities that I mentioned, or call your physician or healthcare provider to talk about getting tested. If you have attended a worship service at the Brooks Pentecostal Church, or you yourself are a close contact of somebody who has attended a worship service at the Brooks Pentecostal Church, please consider getting tested. Finally, I'd just like to remind everybody that these testing options are available. Again, please avail yourselves of them. If you happen to fall into one of those categories, please consider getting tested. Available testing sites, be that at Penn Bay, at Waldo County General Hospital, or at Seaport Community Health Center, are available, and the information on how to access that can be found on our website. I also, speaking of contact tracing, want to provide a bit of an update on some changes to the contact tracing landscape that you may have heard about. Many of you perhaps saw that the United States Centers for Disease Control updated its guidance around who constitutes a close contact when it comes to COVID-19. Previously, the US CDC defined a close contact as someone who spent at least 15 consecutive minutes within 6 feet of someone who was confirmed to have coronavirus. The updated guidance of a close contact considers close contacts as someone who was within 6 feet for 15 cumulative minutes or more over a 24-hour period. The change that the US CDC made was from 15 consecutive minutes to 15 cumulative minutes. Now, while this change at the federal level recognizes the best available science, I want everyone in Maine to know that this change in the federal guidance doesn't really change Maine CDC's approach. That's because we have recognized the possibility of this cumulative transmission of COVID-19 all along, at least since this summer. Since this summer, we have recognized that the risk of contracting COVID-19 depends on the dose of the virus that you get from the person who has it. You can get an infectious dose over, for example, a single 15-minute encounter within 6 feet, or over multiple shorter encounters. From the virus's perspective, one 15-minute encounter is the same as 3 5-minute encounters. As I mentioned, the Maine CDC was once again ahead of the US CDC on this front. For example, our approach to defining a close contact in a school classroom relies entirely on this understanding of how the virus is transmitted. If there's a case of COVID-19 in a classroom, Maine CDC considers the entire classroom to be close contacts. That's because of the repeated short interactions that can occur over the course of a school day. Even before this guidance in our schools, earlier this summer, we applied this same principle to an outbreak that occurred in a workplace, where there were multiple shorter course interactions that over the course of a 24-hour period amounted to at least 15 minutes. Now, what does all this mean for you? Well, frankly, it means that you got to be careful and consider the impact of these short, repeated interactions as compared to longer, sustained ones. This change at the federal level also reinforces the importance of, where possible, minimizing the extent of contact that you've got with others, especially within 6 feet. It's also an occasion just to take stock of the sort of interactions that you have on a day-to-day basis. For example, you may not in your workplace have a single 15-minute encounter with any one person, but perhaps over the course of the day, you spend a few minutes with the same group of people multiple times per day, maybe around the water cooler, maybe in the elevator. Over the course of a day, those folks would be close contacts. And if you tested positive for COVID, or if one of them tested positive for COVID, you would want to consider them as individuals who you may have gotten COVID from or given it to. This change is also an opportunity to underscore once again why masks are so important. Even with masks on, you're still considered a close contact if you spent a cumulative 15 minutes with a confirmed case. But that doesn't undercut the importance of masks. Even though you might be a close contact, your likelihood of contracting COVID and most definitely transmitting COVID is much lower if you're wearing a mask. So with that, I'd like to turn things over to Commissioner Lambrew.
Thank you. Today, the Maine Department of Health and Human Services is proud to launch Strengthen Me, an initiative to help Maine people cope with the stress and uncertainty of COVID-19. This initiative will offer free stress management, wellness, and resiliency resources to anyone experiencing emotional challenges in responding to the pandemic. If you need someone to talk to, information about resources available in your community, or you're concerned about the well-being of a friend or loved one, please call. Strengthen Me is here for you 7 days a week from 8 a.m. to 8 p.m. The number is 207-221-8198. Strengthen Me is confidential, free, and anonymous to anyone in Maine. Strengthen Me is also supporting a number of related programs, including the NAMI Teen Text Line, an expansion of the Intentional Warn Line, and a behavioral health marketing campaign. The Office of Behavioral Health is partnering with Maine agencies for community health workers, regional crisis support, and therapists with specializations in serving populations such as older Mainers and people of color. Strengthen Me also includes the Frontline Warn Line, a phone support service that provides Maine's healthcare providers, first responders, and school staff with help in managing the stress of providing essential services during the fight against the COVID-19 pandemic. Strengthen Me is funded by a roughly $5 million joint grant from the U.S. Substance Abuse and Mental Health Services Administration, as well as the Federal Emergency Management Agency. I would also like to take a moment to share some details and updates on the Maine Economic Recovery Grant Program. Last week, Governor Mills announced $105 million in grants to 2,329 small businesses and nonprofits in phase 1 of this program. The average award was $45,000. We are now in phase 2 of the grant program, and the application deadline has been extended to Thursday, October 29th. That is 1 week from today. The new eligibility criteria in phase 2 have been adjusted to allow for more businesses and organizations to qualify. Specifically in this round, all businesses and nonprofits that have up to 250 rather than 50 employees, businesses and nonprofits that have been in operation for less than 1 year, as well as older businesses, and childcare facilities can apply. I understand that there are many of you who are feeling overwhelmed by the application process. The Department of Economic and Community Development wants to make this as easy as possible for you. They're doing that in 3 ways. First, there is step-by-step guidance on its website. Second, the department and its partners will offer technical assistance next week to help with the application process. And third, on Monday, Commissioner Heather Johnson will be providing guidance through a webinar platform on the application process. You can register by visiting the DECD webpage. That's the Department of Economic and Community Development. There are no calculations involved. You just need to have your previous tax forms and your business information for this year. They will help you do the math. This is another way that Governor Mills and her team stand ready to help Maine residents and businesses not just deal with the direct impact of COVID-19, but its indirect impact on health and the economy. So with that, I'll turn it back over to Dr. Shah for questions.
Great. We will turn to our colleagues in the media. The first question today goes to Brian Sullivan at WABI.
Thank you, Dr. Shah. I wonder if you might be able to elaborate a little bit about the 6 cases you found or the CDC has found in Washington County, and anything that those people may have had in common.
Brian, that is exactly where our investigation is right now. That information's just a couple hours old. I wanted to get it out there just so everyone had situational awareness in and around the Washington County area. We are, of course, in a situation like this. One of the main questions is there anything in common? Was there a common location that these individuals may have been at? Are they from the same town, the same area, same workplace? We'll know more as we touch base with them and learn about where they've been, who they've interacted with. At this time, Brian, we don't have that information. That's because we're starting the investigation process and touching base with folks today. But hopefully over the next couple of days, we'll have a better sense of whether this happens to be an uptick related to the virus being everywhere, or whether it happens to be transmission that may have occurred as part of a gathering.
And one more for you, Dr. Shah, and then I have a question for Commissioner Lambrew, if it's all right. You mentioned people in Waldo County being contacted by your contact tracers, and you ask us to answer their questions. Are you being met with hesitance from people who are being asked questions about close contact?
No, Brian, I'm glad you mentioned that. The answer is no. I offer that as a reminder to folks that when contact tracers reach out to you, if you see Maine CDC pop up on your phone, to please take the call, to please work with them, to furnish information. They are a great resource that can advise you of how to get tested, where to get tested, when to get tested. They're really one of the best points of contact to get those everyday public health questions answered. We've seen great cooperation among the contacts that we've reached out to. We want to make sure that that momentum stays strong.
And Commissioner Lambrew, this is for our sports fans and our sports department. Could you give us a little update as to where we are as you work towards guidelines for winter activities for, I guess, high school athletics?
Sure. So we are working both on updating our community sports guidance as well as working with the Maine Principals Association, which does the guidance for school sports. What we're doing right now is, first of all, looking at what we've learned. We have more experience with different types of sports, given professional sports in different parts of the country. We're looking at different states and what their experience has been with different types of sports. We're also looking at the science of what do we know about mask wearing and distance and transmission. All of that will go into our process to figure out when we look towards winter, when we look towards sports mostly being inside, what changes are needed to the guidance. We are doing this in an iterative process, a careful process. We do recognize that most winter sports begin around mid-November, so we anticipate coming out with that joint guidance hopefully soon.
Thank you.
Great. I'm going to turn next to Dustin at New England Cable News next.
Hi, Dr. Shah. Could you talk again, just to clarify, on the different schools that are impacted by this Waldo County outbreak, and just what's connected to the church, what's not, what's being looked at?
Absolutely. So right now, let me just kind of talk generally about where we are with schools and what we're thinking about with respect to COVID and in the schools in this area. So first of all, I think the most important thing I just want to reinforce is that at this time, we are not aware of any cases of COVID-19, of transmission of COVID-19 in the schools in or around Waldo County. There are no outbreaks of COVID-19 in those schools. Right now, there are 3 schools that are public that we have connected one individual to at those schools. They are the Ames Elementary School in Searsmont, Captain Albert Stevens School in Belfast, and the Mount View Elementary School in Thorndike. Again, there are not outbreaks occurring at those schools. There are individuals who have tested positive as part of this outbreak who have involvement or association with those schools. We're separately working with the school officials in each of those 3 to determine who the close contacts are. In addition to that, there are also cases at the Lighthouse Christian Academy, which is closely connected with the Brooks Pentecostal Church. As of right now, we've identified 7 cases associated with the Lighthouse Christian Academy, which is part, again, of Brooks Pentecostal Church.
How has the church's cooperation with you been throughout this?
We've been working closely with the church to determine who may have been attending certain events, where they may have been, and thus far we've got more to go, more road ahead of us in this investigation. But thus far we've been working closely with the church officials. I'm going to turn now to Charlie at the BDN.
Yep. Hi, Dr. Shah and Commissioner Lambrew. I think my questions are for Commissioner Lambrew today. I was hoping you could tell me a little bit about when officials from Maine DHHS do focused infection control surveys of Maine nursing homes, what that process typically involves, both for in-person and remote, work.
Sure. So when it comes to nursing facilities, there is a partnership between states and the federal government in quality review in these infection prevention and control surveys. So it really works that the federal government sets the standards, and the state of Maine we're the boots on the ground that really work at the local level with the nursing facilities to check in and see, are they practicing in all their shifts the right types of screening? Are they using PPE in an appropriate way? Do they have protocols for what happens if a resident is sick or displays symptoms? So we do this partnership with the federal agency, the Centers for Medicare and Medicaid Services, as well as our Division of Licensing and Certification. I will say during this pandemic, the federal government has been quite strict, and we appreciate that in its guidance on infection prevention and control. So we are following through their guidance. We know that that often does mean more frequent engagements with some of our nursing facilities and our hospitals and other regulated facilities, but that is par for the course during a period of time when we have seen transmission, especially in nursing facilities.
And do you think those inspections are effective at identifying shortcomings that could stop or limit an outbreak of COVID-19?
I think they're part of the larger set of activities that do make nursing facilities safe. Part of it is inspections and having that kind of on the ground, response to practices. Some of it is education. We've been hosting numerous webinars to provide the best practices to nursing facilities and other healthcare facilities to give them the tools to act. It involves training to make sure that all the personnel understand the science, the best practices, the scenarios of what to do. So it is one tool in the toolkit to keep nursing facilities as well as other patients safe.
I would add on top of that, the inspections are important, but there's also data to suggest that what is also important is keeping community rates of COVID-19 down as well. That in addition to inspections is another tool to keep the overall risk of the residents and staff members who are at long-term care facilities and other facilities to keep them safe. So we've got the inspection route, but we've also just got our own responsibility as community members to stay safe, because that in turn helps keep people in those facilities safe as well.
And I would just add two items. We do work in partnership with the long-term care Ombudsman, who is there actually as an advocate for the residents. We have a very strong partnership to make sure that we do our work in tandem. And we recognize that part of the challenges to what Dr. Shah just said about community transmission is staff. So we have been working with nursing facilities and other group homes, assisted living facilities on a portal, for example, that will give them access to substitute staff if a staff member does turn positive with COVID-19.
I'm going to turn next. You bet, Charlie. Next up is Amy Brown at WERU.
Thank you, Dr. Shah. I think my first just quick kind of follow-up question is for Commissioner Lambrew. When you're talking about the new Strengthen Me program, you mentioned the frontline warm line and the team text line. Are those numbers changing as well, or are they just going to be funded under this umbrella?
Mostly going to be expanded and funded under this umbrella. We have been grateful for the partnership. For example, the frontline warm line is largely staffed by volunteers. People who have been there and done it, who get the training to man or to person that hotline to make sure that when people call, they have help not just from an expert, but somebody who has done these jobs. So mostly what we're doing is taking those volunteer efforts, those efforts we have been doing because we've been concerned about mental health from day one. From the start of this pandemic, we have been trying to make sure that people have the supports that they need during this tremendously stressful and anxious time. So what we're doing is using this $5 million to leverage it, to build on it, to build community level activity as well as hotline activity, recognizing that we need to reach out to people in all sorts of different ways to make sure that they have access to these resources.
So the phone numbers are remaining the same, though? People still contact them the same way?
Yes.
For those two programs. Okay, thank you. And Dr. Shah, I have a question from a listener about whether you think at this point Maine should consider fines for not wearing face coverings in places like stores and offices, as has been done in other states. The listener asked that question a few days ago. You may have seen the article today in the Bangor Daily News by Abigail Curtis, interviewing folks in Brooks, where some were still not wearing masks in the stores there because one was quoted as saying she believes wearing masks spreads the virus or makes people sicker. At what point does that become something that enforcement needs to be stepped up on?
Mm-hmm. Well, Amy, I'll start just on the scientific piece, and then Commissioner Lambrew and I can go from there. Let me just speak directly to folks who have questions about masks, because there has been information that's been put out, and I'll just say much of it has been incorrect, suggesting that masks don't work or that they can even pose a risk to the person that's wearing them. And virtually every one of those pieces of information that's been put out there has been debunked and is not accurate. What we know now from dozens of studies is that masks are not only safe for the person who's wearing them, but they do an exceptionally good job of reducing the likelihood that you will transmit COVID to somebody. And they also are starting to show benefit in reducing the likelihood that you'll get COVID from somebody. So it's not just about protecting you, but it also is something that you can do to protect others. So the science around masks is really where we should start the conversation and encourage people to use them, even if they're not worried about themselves, even if they don't think they're going to get COVID. They should recognize that the more people who are wearing masks in a community, the lower the likelihood that, say, older folks or folks who are immunocompromised might get COVID. That's where we should be starting the discussion.
And I'll add that the authority that we have during this unusual time under 37B MRS 786 subsection 1, an individual who fails to comply with an order by law enforcement to comply with an executive order may be charged with a Class E crime that includes punishment of up to 6 months in jail, a $1,000 fine, and the payment of civil damages to the state for its costs associated potentially with testing, investigating, and contact tracing. All that said, that's the ultimate measure that we would use should we find persistent and potentially harmful non-compliance with our executive orders. As we've said repeatedly, people of Maine want to keep each other safe. They want to protect their communities. They want to be able to make sure that kids can go to school to learn and they can go to the shops to go grocery shopping. So our approach is to have that be the last resort, the first resort being education, the second being reminders, the third being more aggressive, like trying to communicate to people what the consequences are of them not following these orders. To date, we have not yet needed to use this authority for lack of face covering wearing, but it is an authority that exists in Maine should we need to use it.
So for someone who's shopping in Brooks who is worried, they take what you're all saying very seriously, and they see people in the store in a town that's having a major outbreak not wearing masks because those folks don't believe what you're saying. They're getting their information elsewhere and they're believing that masks cause COVID or whatever conspiracy theories going around at the time. What do those people do who are concerned about their own safety, the folks who are taking you seriously at this point?
Well, one new aspect of our enforcement policy is recently in our most recent executive order on face coverings, we do ask that establishments that have that kind of public facing environment like retail stores, public, state buildings, as well as different types of sites, lodging, they should enforce the policy. That means that if somebody does come into their establishment and they're not wearing a face covering, they can ask them to leave. We are looking for all the different tools to make public spaces safe, but I would go back to 2 points that we've said on this press conference before. One is that a lot of our transmission is not in public spaces, it's in private spaces. Private social gatherings is equally important to wear face coverings when you're at gathering somebody else's house, or when you are seeing people outside for gatherings. So we do encourage people, not just in public spaces, but in private gatherings, to wear face coverings. And I'll just go back to the fact that I think Maine people have proven that they believe in science. They believe in what we're seeing about the value of face covering. And I think, as Dr. Shah mentioned, the evidence is there.
Thanks.
Next up is Joe Lawler at the Press Herald.
Yes, I have 2 questions. Thank you. The first is when we're discussing the Waldo County Church outbreak with the Millinocket outbreak, has there been any substantial change in the state's ability to respond to outbreaks? And if so, can you describe how, and is that possibly making a difference in curtailing the Waldo County outbreak?
Joe, I'll start from just the bedrock tools in public health. And what we've been able to do just in the past 2.5 months is to be able to expand the volume of testing that our laboratory can process by adding more staff there. Now, we were never stressed in terms of testing back in August either, but having additional backup capacity, excess capacity, headroom for more testing definitely helps us cast a wider net. So that's one thing. The other thing is that we have, as other states have as well, we've learned from each other, and we've taken a look at how outbreaks of COVID have propagated. So we are better able to ask pointed questions. For example, something I talked about a moment ago, cumulative exposure rather than consecutive exposure. Now, again, that's not a change that has happened since August, since Millinocket. It's something that's been an evolution since over the summer. But I think the real answer here is that we are just, with every outbreak of COVID-19 that we respond to, we learn something. It may be small, but in the aggregate, all of those things make our team better able to zero in on where we think things may be going and anticipate the next steps. And that, I think, in the cumulative and the aggregate, helps us get a handle on things all the better.
Okay, thanks. And my second question is just about, whether it's Thanksgiving coming up, or if people want to have, say, a Hubie Halloween watch party. There people are gathering and indoors in private gatherings. And do you have advice for, I know you say limit the number, wear masks. Is there anything else that people can do to limit the risk? Because we know people are going to do these things. So what can be done?
Well, I'm not going to comment on the choice of program because I don't think that's what you're going for. But that being said, I think the first thing is to acknowledge that it can happen to them. When you take a look at some of the outbreaks that we have had across the state, across the country, one of the themes that starts to jump out is that a lot of people involved with them didn't think it could happen to them. And so I think as we go into colder months, more folks inside, holidays, communal gatherings, I think the first thing we've got to do is just all acknowledge that it can happen to us. It can happen in our state, in our county, in our family, in our house. That's step one. That's what my own family and I have done. We've just been a lot more clear that since we're going to be inside more, we've got to be a lot more judicious about whom we're hanging out with, how, under what conditions. So I don't think any of this, Joe, is a magic wand. There's not a single formula that can be followed that will necessarily result in more or less. It's about making sure that all the principles we've talked about for months, distancing, masking, keeping ventilation robust, all of those things put into place at one time. And when any one of those is removed, the foundation gets weaker.
And I'll add that because of the high demand for Halloween guidance, we did put a seasonal activity checklist on our checklist site. It's a little different than many of our others, which are for commercial reasons, but it does give families and communities a guide to lower risk activities like having a Halloween movie night or a virtual Halloween costume party, moderate risk activities, one way or otherwise distance to trick-or-treating, as well as what poses higher risks. We appreciate the fact that people need to make decisions and informed decisions. So what we did was try to give communities a guide of the different types of activity and their stratification by risk so people can make choices to figure out how to celebrate this holiday. Because again, our goal always is to not say no, not to say whether or not somebody can celebrate, is to give them tips on how to do so safely.
If I could just, one more little quick thing. What do you think about if you're having a gathering and it's not the weather's not too bad, having an outdoor tent with heaters as opposed to having it inside?
So in general, Joe, the more that you can be outdoors, the less likelihood of transmission there is in general. But if we get to a point where the outdoor tent has walls and has no ventilation, functionally it becomes an indoor space. We also have to add on the possibility that the heater itself could generate fumes and other gases that themselves may be somewhat toxic. So I think it's a situation where there isn't a one-size-fits-all rule. Folks have got to be careful. If they can be outside with a tent where the walls are open, that's going to increase ventilation, and that's going to help. They can be outside and it's a warm day and they don't even need the tent, that's preferred. But if they get to a point where they're outside in a completely enclosed tent, they lose a lot of the protections of ventilation and ultraviolet light. And if they're throwing a heater in there, that could potentially add to the risk of having more carbon monoxide and everything. I think folks have got to be careful and make sure they're doing things that really reduce the risk without introducing new risks. Next up is Allison Ross at WMTW.
Hi, Dr. Shah. Thanks so much for taking my question. I have two questions today, one for each of you. So starting off, Dr. Shah, NPR did a new story about 2 international studies saying that kids could actually be safer in schools doing in-person instruction because of mask mandates, cleaning, and social distancing measures that are in place in the classroom. So do you think there could be any truth to that, and having them in these controlled settings rather than maybe in a community that's experiencing an outbreak right now?
Mm-hmm. Allison, I'm glad you raised that. I'm familiar with the 2 studies that were referenced in that article, one from Spain and another one that's forthcoming. And let me say 2 quick things. The first is that in the midst of a pandemic, having that rapid scientific information is critical. But it's just that. It's initial scientific information. And we've got to make sure that we are taking a global view, literally, of not just one study here, one study there, but taking a holistic view of all the data. Now, the other thing to bear in mind is that there are still, when it comes to schools and children, there are probably still more unknowns than there are knowns. And so that changes how we think about what policy decisions need to be made. What I want to say about those studies in general, as well as other data that are emerging, is that they are A, worth paying attention to, and B, provide some reassurance that having children be in classroom is something that can be done safely. Partly because of the way, for example, that schools in Maine have taken these protective measures really seriously, spacing out desks, making sure that face coverings are being worn. Those data are encouraging, and it suggests that these measures that have been put into place have a real value to them. But we also have to make sure that the studies are truly representative. For example, were the schools in Spain similar to those in Maine? And we also want to make sure that there's not selection bias happening, that the schools that were participating were not ones that knew that they were doing a good job, so the data were skewed. So while I am encouraged by those data, we've got to make sure that we're keeping an eye open for other data that might suggest the opposite.
Okay, great. And then one other question for Commissioner Lambrew. So there was a section that was updated in community sports guidelines And it said that this document applies to community-based sports clubs, teams, and events. Professional sports teams and events have different COVID-19 prevention considerations and are covered by separate state guidelines. So I was wondering, where do college sports fall into this?
Yes, and I will speak to what I do know, which is the state of Maine does not have guidance for professional and collegiate sports. There are national associations that do professional sports. We know that there are different leagues that govern the different interscholastic collegiate sports. So that is not a set of guidelines that the state does. So we will make sure that that checklist is accurate.
And sorry, last question. Has there been any more discussion with the Maine Amateur Hockey Association about still being able to play?
So we have, there was the event about 10 days ago where a referee who was COVID positive attended a number of games, and there was a pretty massive contact tracing effort that was launched as a result, not just in Maine, but in New Hampshire. So we continue to track. We don't yet have any evidence of spread from that particular event, but we did use that occasion to ensure that all of our different community sports organizations do understand our guidance. They, have seen what we recommend in that guidance, that they do look hard at the sport-specific guidance that's been issued by different organizations, and we urge them to adhere to it, because we do know that in Vermont and New Hampshire, we've seen cases of hockey games, for example, causing spread. So we continue to urge all those community sports organizers to look hard at the guidelines, to adhere to them, and to recognize that by adhering to these guidance, we again can allow activities like hockey to continue, but do so safely. Should we see problems and persisting problems with sports like hockey, we may change our guidance, but at this point, we're not changing it.
Okay, now I'm done. Thank you.
No worries, Allison. One more note on schools. What I want everyone to know is that what these articles, I think, and some of the other recent publications around COVID in schools, what the question they raise is not so much the question, it is partly the question of the safety of opening schools, but also the simultaneous question of the propriety of closing schools as well. And how we balance both of those risks and benefits on both sides. And I just want everyone in Maine to know that as we are thinking about the public health approach to schools, we keep all of those various factors, the pros and the cons on both sides of the ledger, we keep those in mind. I'm gonna turn next to Evan Popp.
Hi, Dr. Shah, thank you. So we heard from a reader who's been trying to get a flu shot and said that there's a lack of shots meant for those over 65. And there have been media reports of those shots running low in other states. Do you have any information on how large an issue this is in Maine? And can you say what the CDC might be doing to address it?
Sure, we're not aware of systematic shortages of the high dose flu vaccine, a vaccine that seems to generate a somewhat stronger immune response, especially in older individuals. There may be periodic shortages just in connection with temporary stockouts, but there's not a systematic shortage at the manufacturer level or at the distributor level. We've heard reports of individuals indicating that they are not able to get that high dose shot. Subsequently, I've also heard reports of folks who were able to. I took one of my family members who called around to a bunch of different places and was able to find it without too much difficulty. So I think what we've seen, Evan, is there's pretty significant day-to-day variation. They may, a particular location, physician's office, pharmacy, et cetera, may have it on Monday, may not have it on Tuesday, and then have it back again in stock on Wednesday. Our recommendation is that you call around, you call different places, and you call often. When you find a place that has it, ask if they can reserve the dose for you.
Thank you. And then, sorry, just a follow-up question for Commissioner Lambrew about the conversation around consequences of violations of public health orders. Kind of a two-part question. I was wondering what department within state government is responsible for levying those consequences. And then the second part, I'm just wondering about, we've seen a lot of violations of those health orders in terms of things like political campaigns, not necessarily just individual people. And so I'm wondering, when it comes to an entity like a political campaign, are there any conversations happening within state government about more strictly enforcing those rules, or about levying some of the consequences you talked about for those venues or organizations that we know have violated the health orders?
Sure. And I do want to begin again with our approach to enforcement. We're doing all this work as a means of protecting individuals, protecting the people they come in contact with, protecting communities and families. So we always begin with the premise that people want to do that. We don't think people are maliciously not following our practices because they're trying to infect other people. And in fact, I think our approach is emblemized in what we did this summer, which was we gave grants to our municipalities through the Keep Maine Healthy program, because we knew that the local ideas for how to communicate with neighbors and friends would be more effective potentially than what we say here at the state or using these enforcement tools. So we always approach this as a public health imperative. Going to the enforcement tools, it depends on the circumstances and the situations. We do work with agencies, with licensing agencies or licensing authorities, as well as with the Office of Attorney General as needed, to figure out what particular enforcement authority should be used in a particular circumstance, and that varies. And going to political gatherings, large gatherings, again, we view them all the same from a public health lens. A large gathering above 100 outside, irrespective of the reason for why people are gathering, does pose public health risks. So we always urge, when we hear gatherings are happening, that organizers look at our public health guidance. We encourage 6-foot distancing at such events, face coverings at such events. And when we think there's a real problem, we work with the organizers to see if they can change the events to be more like 100, maybe staggered events, different constellations to keep people safe.
I'm going to turn now to Patty White at Maine Public.
Thanks, Dr. Shah. There were a few churches that were at that fellowship event that seems to be the start of the outbreak in Waldo County. Are there any cases linked to those churches? And either way, has the CDC been in touch with any of those churches? One of them has videos online of services where it doesn't look like there's much masking or distancing.
Mm-hmm. Patty, at this time, we'll get for you the exact numbers of individuals from some of the other churches that attended, as well as a Bible college who attended. There have been scattershot cases, but just to make sure we're getting you the exact up-to-date number as of 2/47, we'll follow up with you on that. We have touched base with those churches, mainly to, again, start the public health investigation piece. For where we are in this outbreak investigation, our first job is to figure out where people may have gotten it from and who they may have given it to. That's where we are right now. After we get our head around that, that's our top imperative. After we get our head around that, we have conversations around the things that you mentioned, compliance and other things, to help them along the way to keep parishioners and congregants safe. But we want to make sure we address the most important thing, which is characterizing the outbreak, understanding the extent of spread. That's the first most important thing we have to do. Then we can move on to some of the other things down the line, as we've done in other outbreaks.
Okay, thanks. And then another question I have is, despite this outbreak in Waldo County, our COVID metrics have been doing consistently well, and periodically in the past, you've shared with us why you think Maine has done well. And I think some of those reasons have evolved over time. What's your current take?
Okay, well, I'll try to do this really quickly so we don't, okay, so I think there's a few things going on. The first, though, Patty, is that there are still some concerning signs on the horizon. I'm encouraged by the favorable position that Maine is in, certainly relative to other states, even relative to other states in the Northeast. But we're not taking any laps because there's always the possibility that there are worse things coming. Just in the past few days, the average number of daily cases has started to trend upward. Past few days, it's been in the high 30s, up from the mid 20s. So there are already concerning signs on the horizon. Some of that is, of course, driven by what's happening in Waldo County, but we're keeping our eye on the possibility that things may turn in a different direction. And I just want everyone to be aware of that and be prepared for it. That being said, over the last few weeks, what I think has really made something of a difference is the expansion of testing. Our positivity rate stands at, depending on when you take a look at it, the lowest in the country. On some days, if you round down, we're at 0. Not long ago, we were in the 0.4s, we're in the low 0.5s right now. The national average is about 5 to 5.5. The reason that's critical, the reason that massive expansion in testing is so important is that it allows us to grab cases and identify them before that and work with those individuals who test positive early on and ask them to isolate and to work with them to provide them what they need to stay in isolation. That means that they can limit their exposure to others and not spread it and generate outbreaks. In the recent few weeks, to me, that is among the reasons that we've been able to keep a lid on things and characterize what's going on early rather than late. The other is that I know that there have been questions today about compliance and enforcement around mask wearing. We can all do better with respect to wearing masks. Every community in Maine can still do better. That being said, when you take a look at the survey data of where people report whether they're wearing masks, relative to other states, we are doing well and in a favorable position. Combination of those two things, favorable mask wearing with rapid expansions of testing, mean that we can get a hold on things before they spiral out of control. There are still risks on the horizon, especially as folks go inside. We've seen that in the upper Midwest, but right now, that's kind of my quick take. Not so quick, but that's my take.
Thanks for answering.
Commissioners, anything that's on your mind?
Had 2 more layers. First of all, Maine businesses, Maine schools have really taken this seriously. The checklist that they've implemented, the protocols and sites have been outstanding in most cases. So we really have seen the communities of organizations stand up. And I would just have to say, I think leadership matters. I mean, Governor Mills has from the start talked to Maine people about why this matters, why she's making these difficult decisions, and this ability to communicate both the science about what's going on and the why we're asking people to do that. I think that's leadership from Dr. Shah to Governor Mills. I think that's made a difference.
Thanks.
We're going to turn now to Patrick Whittle at the AP.
Thank you very much. And as a fan of June Squibb, I will definitely be watching Hubie Halloween. I want to make sure I understand exactly what's going on with Bayview Manor. So as I understand it, it's a sort of a similar situation to what's happening with the 3 public schools, where there is a concern that there is a positive case in the facility that might have overlap with the church outbreak. And if that's correct, is it a resident or is it a staff member or someone else?
Patrick, you're correct as to the first part. The concern is that there is an individual. I don't think there's any compunction about noting that they are a staff member, not a resident, but an individual staff member who is connected with the larger Waldo County outbreak. That individual, we've worked with the facility and that individual to make sure that they are not interacting with patients. But we also are simultaneously working with the facility to make sure that they can conduct testing on the possibility, to investigate the possibility that there may have been transmission before that individual tested positive and was isolated.
And an initial round of testing showed that that person was the only case.
That is correct.
Okay.
That is correct.
So right now, Bayview Manor right now is not the source of its own outbreak.
Also correct. And there's 2 parts to what you said, Patrick. They are not an outbreak, and they were not the source of any outbreak. So both are correct and accurate. But again, in the interest of transparency and telling everybody what's going on in Waldo County, that is a site that we were concerned about. We worked with them to conduct testing. There may be another round of testing as well. And so we just want to make sure we're sharing and pulling back the curtain on what's going on.
And the case involves a staff member. Did I hear that?
That is correct.
Right. Okay. And are there any other aspects to strengthen me or strengthen ME beyond the helpline? Like, does this also sort of marshal resources from the community groups and agencies that are going to be collaborating, and what specifically else will they be doing?
Yeah, Yeah, so it's a multi-pronged initiative. For example, we're working with community health workers who are in local communities, usually from those communities, giving them the tools that they need to turn to their neighbors and friends to try to promote good tactics for resiliency, dealing with anxiety, trying to figure out how to recover. We are working, again, with our kind of frontline workers to make sure that they have the kinds of supports that they need with targeted mental health just for those workers. We are going to do a behavioral health campaign because what we do know is that people only tend to find services they need at the moment that they need them. So we'll try to do a broader education or connection campaign. So when people need those services, they know where to turn, as well as making sure that, again, in a time when people can't really do as much in-person behavioral health, that we have other means, be it phone lines, video, et cetera, Zoom, to get people the support that they need. We're trying to make this an all-around campaign for COVID-related mental health, knowing from the past that it does take time for people to recover. Even when the pandemic ends, there will be after effects, PTSD, other types of impacts of COVID-19 that will be a tail going long after COVID-19 ends. So we are doing this campaign for the long run.
So it's not just a helpline, but it includes a helpline?
Yes,
okay.
Includes multiple helplines, includes multiple programs at the local level. It is a comprehensive campaign, includes again, ad campaign to connect people to services. So it is about community services as well as helplines.
Okay, terrific. Thank you very much.
Thank you, Patrick. And the final question for the afternoon goes to Rosalind Flaherty.
Hi, Dr. Shah. This question is about the possible West Nile case. Do you think, well, Maine CDC says there hasn't been a case of it since 2018. Do you think it's because more people are outside because of the pandemic? And are you concerned with more people outside?
You know, Rosalind, it's a very interesting question. My team and I were discussing that just yesterday about whether there might be a connection. It's obviously impossible for us to know for sure whether it's a function of more people being outside, but we don't think so directly. The reason I say that is that if this were a direct function of larger numbers of folks being outside, which is a good thing, we would have seen more and more other such diseases, be they West Nile or some of the other mosquito-borne diseases that are known to affect Maine. That being said, it's a possibility and it's one that we can't rule out entirely, but it's not our leading hypothesis. Our leading hypothesis is that this was an unfortunate situation that resulted in a case of West Nile, but we don't think it necessarily signals that folks should stay indoors. We still think the right place to be, both from your own personal health, as well as to do things like stay distant and reduce your likelihood of COVID, the best place to be is outside. The single case of COVID-19 should not dissuade you from going outside. What it should do is serve as a reminder that when you're going outside, a great thing to do is to wear long sleeves, long pants, wear mosquito repellent. That'll help keep you safe, not just from mosquitoes, but from things like ticks, which are also really active at this time of the year as well. So please continue to go outside, enjoy the amazing scenery that we've got here that I've really enjoyed taking a part of over the last year and a half, but just do so really, really smart as a way to reduce your risk.
Thank you.
Commissioner, that was the last question for the afternoon. I want to turn it back over to you for any concluding thoughts that you've got on today's announcement of the assistance programs.
Well, again, we stand ready to help people in Maine, businesses in Maine that are struggling. We also want to thank our partners, which are the health systems. We have doctors, nurses, primary care providers who are on the front line providing the same type of education that Maine CDC and the state does. We have hospitals that have the capacity, should we need it, to take care of people with COVID-19. We have backup plans that are there should we have the kind of surge that is experienced in other parts of the country. So this is an all-around team effort, and the Maine healthcare system has been fabulous. They have been fabulous partners and leaders in this effect, and I'd like to thank them.
Great. Well, thank you so much, everyone. We appreciate everyone's time this afternoon, joining us to learn the latest of where things stand. As always, please be kind, take care of one another, and we'll talk again next week.